or any non-Kannada speaking? Telugu. English okay na? Because there are some non-Kannada speaking. ಆಮೇಲೆ ಟ್ರಾನ್ಸ್ಲೇಟ್ ಏನಾದ್ರು ಡೌಟ್ಸ್ ಇದ್ರೆ ಖಂಡಿತ ಅಲ್ಲೇ ಕ್ಲಿಯರ್ ಮಾಡೋದಕ್ಕೆ ಒಂದು ಅವಕಾಶ ಮಾಡ್ತೀನಿ. Anyway, I think they've given you some lengthy forms for you to fill up. Don't worry. Don't worry too much about it. It is sadhanavagi. It's a common kind of questionnaire. ಅದರಲ್ಲಿ ಟ್ರಾನ್ಸ್ಲೇಷನ್ ಇಲ್ಲದಿರೋದ್ರಿಂದ ಕೆಲವರಿಗೆ ಸ್ವಲ್ಪ ತೊಂದರೆ ಆಗ್ಬೋದು. But don't take it too seriously. Stress is part and parcel of our life. Whether we like it or not, we are going to have it. So, ಅದು ಯಾವುದು human interaction, how body responds to stress, how we should actually respond or how we should make it less stressful. This is something which we are going to briefly talk about. Something which is manageable at a end user level on a day-to-day basis. So let me start off. What is stress by definition? It is basically an inability for an individual to perceive that threat. The moment you are exposed to either a real or imagined kind of a situation which is going to cause some level of threat to the body goes into a predefined response. That is basically stress. If the stress is continuous or persistent over a long period of time, it is likely to affect both our health, our productivity, our social life, you name it, every aspect can be affected. So stress, inherently, we are born to deal with it, but the question is, are we dealing it in the right way or not? Unfortunately, psychiatrist is not mentioned anywhere there. So I don't know whether mind is a stressful or not a stressful job. I think it is. But these are some based on the US survey. A lot of the most stressful and the least stressful kind of jobs. Anybody fit into any of these categories? Right. Okay, event management, my God. Absolute nightmare. Okay. Anybody else?
7.
Senior executive. Extremely, because you are responsible for so many other people under you. So that is number of times you are multiplying into in terms of stress. Professors, dietitians, medical record, librarians. Professor. There you go. Least stressful. Looks upon him. Okay. What is the stress continuum? See, as I said, the moment if there is a line entering, there's only one single exit from this particular room. We all need to panic. ಎಲ್ಲರಿಗೂ ಗಾಬರಿ ಆಗೇ ಆಗುತ್ತೆ. That is our immediate kind of short-term response. Fight or flight. Our body is programmed to do only one of those two things. Either you think about fighting that lion and making your way out, or just make it run. So that is your acute response. But what if the lion decides to kind of sit there, and you are also stuck because there is no other exit there? Then the body starts to adapt itself for the stress response. If it is over a prolonged period of time, then the resistance and the exhaustion will set in eventually. That is a natural programmed response of the body. When things like exhaustion happens, as the next slide will show, this is what the initial response is. The body gets prepared for that fight or flight. Suddenly the heart will start racing, then your muscles and all will go into an absolute spasm. The circulation will start gushing around the body, mainly to the brain, to some of the very key centers which are involved, and hence you feel that flushing of the face. It's just those kind of experiences when you walk into that interview room for the very first time, or just before you enter the examination hall as a student. The kind of anxiety is, for some people it is quite okay for them to be anxious, because there are a lot of positive aspects also when people are anxious. But again, when the resistance stage sets in, that is when the body kind of starts to get exhausted, because adrenaline is not there anymore for it to kind of keep pumping. And then the fatigue, the anxiety and the tension starts setting in. Eventually, there's only that much the body can produce in terms of the adrenaline. And once that is actually exhausted, there is no more adrenaline that can be released. As I said, stress is not always bad news. At the peak of the adrenaline production, the performance is going to be absolutely fine. Because this is where you would want to kind of have the optimum level of performance, which is when you are starting to kind of speak much more clearly, much more trying to gather your own thought process. But once the anxiety zone kicks in, this is the famous Yerkes-Dodson curve, wherein once it gets to the stress zone, that's when the panic and the anxiety symptoms will start setting in. That's when your performance starts to kind of just goes downhill. How many people would agree on this kind of a model wherein their life is divided exactly into each and every aspects? How many lucky people are there in this room who have an absolutely fantastic work-life balance? Yes, Chana, or work or life balance is either. Kargila, unfortunately. None like either. Unfortunately, we end up working almost 2/3 of our day just doing work, and everything else gets squeezed into the remaining part, which is where you got to try and reverse it. On the contrary, this is how at least you can aim for. Yes, it may not be ideal in all realistic terms, but at least you can aim for something like this. ಈಗಿನ ಕಾಲದಲ್ಲಿ ಎಸ್ಪೆಷಲಿ ಇರೋ ಒಂದು ಟೈಮ್ ಪೀರಿಯಡ್ ಅಲ್ಲಿ ಯಾವ ಏಜ್ ಗ್ರೂಪ್ ಇಸ್ ನಾಟ್ ಮಾರ್ಟಿ ಫ್ರಮ್ ಸ್ಟ್ರೆಸ್, ಎಸ್ಪೆಷಲಿ ಸ್ಟಾರ್ಟಿಂಗ್ ಫ್ರಮ್ ಚಿಲ್ಡ್ರನ್. ಚಿಕ್ಕ ಮಕ್ಕಳಾಗಿದ್ದಾಗ ಸ್ಕೂಲಲ್ಲಿ ಪ್ರೆಷರ್, ಓದೋ ಚೆನ್ನಾಗಿ ಓದು, ಡಾಕ್ಟರ್ ಆಗು, ಲಾಯರ್ ಆಗು, ಅಥವಾ ಏನಾದ್ರು ಆಗು, ಒಟ್ರಾಸಿ ಓದು. ಅಲ್ಲಿಂದ ನಿಮ್ಗೆ peer pressure start. They are pushed right from the word go. You start kind of pushing them, perform. Then they somehow manage childhood and then come to the teenagers. Then they have all that company kind of issues, peer pressure, as in ಅವನು ಯಾರೋ ಸ್ಮೋಕಿಂಗ್ ಶುರು ಮಾಡ್ಕೊಂಡ, ಇನ್ನೊಬ್ಬ ಕುಡಿಯೋದು ಶುರು ಮಾಡ್ಕೊಂಡ, ಅವರೆಲ್ಲ ಒಟ್ಟಿಗಿರ್ತಾರೆ, ಚೆನ್ನಾಗಿ ಮಜಾ ಮಾಡ್ತಾರೆ. Why not me? Why can't I also be like them? So the peer pressure on all the good or bad things, it's not always bad things, but ella taranu pressure does start. Somehow you manage all that college and get into the adulthood. Job, ಕೆಲಸ ಸಿಕ್ಕಿದ್ರು ತೊಂದರೆ, ಸಿಗಲಿಲ್ಲ ಅಂದ್ರೂ ತೊಂದರೆ. If you get a good job, is it a better pay, better work prospects, better future? And gone are the days when people work with loyalty as a mantra behind. Nowadays, it's personal progress. They want to progress as fast as possible. So the rat race continues. Middle age. Yeah. Even earlier to middle age. Again, if you don't marry, there is certain kind of pressure. If you marry, I won't say anything about it. Then kids, how they kind of develop, ಮನೆ ಇದೆಯಾ ಅದೊಂಥರ ತೊಂದರೆ. ಅದು ಮನೆ ಕೊಂಡ್ಕೊಳ್ಳೋದಕ್ಕೆ ಇನ್ನೂ ಒಂದು ದೊಡ್ಡ ಯಜ್ಞ ಮಾಡಬೇಕು. Come to the latter part, then all your health issues start to accumulate, start to bother things. So even if you have a very good family balance, the health is one of the kind of entities which start to affect your own day-to-day proceedings. So what are the consequences of stress? Obviously, when individuals go through the acute stress response, as I said, the heart will start pumping, blood pressure will increase, they will start getting aches and pains in the body. They'll start kind of having all the features of an acute panic. There are also psychological symptoms. ಅಂದರೆ ಯಾವ ಥರ ಒತ್ತಡ, ಮನಸ್ಸಿನ ಒತ್ತಡ, ಟೆನ್ಷನ್, ಕೋಪ ಬರೋದು, ದುಃಖ ಪಡೋದು, ಕೆಲಸ ಎಮೋಷನಲ್ ಆಗೋದು. There are a lot of kind of negative contexts also wherein people will start thinking about, will I actually succeed in my life? Will I actually hit the aim that I am actually targeting? What if that doesn't happen? What if my life doesn't pan out? These what ifs and hows and whens will start kind of tormenting them to such an extent that they stop enjoying life. Behavioral symptoms. Again, sickness absenteeism is one of the most common kind of problems that people come across. Lot of bad behavior or habits like smoking, drinking, and bad social activities. All these are, again, they are consequence of the so-called stressful life that we live. Why does stress affect some people and not everybody else? It's like you can listen, whereas some people can't stop talking. It's the way how they perceive stress. It's not necessarily an individual's kind of a makeup or a genetic makeup that an individual is born with that dictates what the stress response is going to be. So if you have had a very bad or a traumatic childhood, the way how you perceive stress is very different to someone who's never been exposed to stress at all. And this has been kind of evidence-based right throughout as to individuals how they become personality disordered purely because of their childhood experiences is one consistent factor that comes out even when people are in anxiety kind of disorders. So it's how people perceive stress is one of the most important factors. Their own experience about how they handle stress. Some people are very calm. ಏನು ಬೆಟ್ಟ ತೆಗೆದವ್ರ ತಲೆ ಮೇಲೆ ಹಾಕಿದ್ರು ಅದ್ರ ಬಗ್ಗೆ ಜಾಸ್ತಿ ತಲೆನೇ ಕೆಡಿಸ್ಕೊಳ್ಳಲ್ಲ. They will not actually break even a sweat even if the company is going diwala. But it's not that they are not experiencing stress, it's the way how they kind of project it across also. A lot of people talk about social support because there are a lot of times that families are becoming more and more nuclear. Nowadays there is also this fact that if husband and wife are together, we call it a joint family. Because it's come to that kind of a state, because gone are the days when people used to have extended and even more relatives falling in left, right, center. Because when I used to grow up, there were probably 8 to 10 people always there in the house. And that kind of exposes you to a lot of different kind of scenarios that you have to manage. So the dependence on parents were very, very minimal. Whereas in this day and age, you are entirely dependent on your mom and dad who are also working. So there's hardly any kind of social support around you. That also dictates how well the body or the mind perceives stressful situations. I won't talk too much about the locus of control, because that is more to do with how psychologically minded an individual is. Because if you feel, oh, ನನಗೆ ಯಾಕೆ ಈ ಥರ ಆಗ್ತಾ ಇದೆ, ಯಾವಾಗಲೂ ಪದೇ ಪದೇ ನನಗೆ ಈ ಥರ ದುರ್ಘಟನೆಗಳು ಆಗ್ತಾ ಇದೆಯಲ್ಲ, why am I in the receiving end all the time that so much of bad things happen to me? If I go to work, my boss fires me. If I come home, my husband fires at me. If I am with the kids, they don't want me. So it's that kind of hostility or that loss of control over a particular situation which also dictates why individuals kind of react differently to different stressful situations. Any questions until now? Because we'll start thinking about how do we manage stress. First and foremost, acknowledge the fact that you are going through a stressful period. The worst thing is not even responding to the fact that your body or the mind is going through a continuous period of stress. If you can't identify, you cannot do anything about it. Adhikoskarane, they have given you all your questionnaires. Questionnaire is one way of trying to kind of do a tick box. But it is not, you know it best whether you are going through a stressful period or not. Nobody else need to tell you what it is. But definitely think or introspect what is your body going through or what your mind is going through. Simple time management. ಇವತ್ತಿನ ದಿವಸ ಏನೇನು ಕೆಲಸ ಮಾಡ್ತೀವಿ ಅಂತ ಬೆಳಗ್ಗೆ ಎದ್ದಿದ ತಕ್ಷಣ ಒಂದು 5 ನಿಮಿಷ ಒಂದು ಯೋಚನೆ ಮಾಡಿ. What am I going to do today? How is my day going to be planned out? It doesn't have to be written on stone, but at least you can plan well in advance. Manage your time. It goes by the very simple Pareto's principle. 80% of our effort goes into doing 20%. Whereas the remaining 20% is what we are giving to the more important aspects of life. So, reverse it. Action plan. There are definitely going to be a lot of stressful things that you will come across. Have some kind of a plan. ನಮ್ಮ ಅತ್ತೆ ಮಾವ ಬರ್ತಿದ್ದಾರೆ ಇವಾಗ, ತಲೆ ಮೇಲೆ ಕೈ ಇಟ್ಕೊಂಡು ಕೂದೋದ್ರಿಂದ ಏನೂ ಆಗಲ್ಲ ಹೇಳಿ, ಓಕೆ ನೆಕ್ಸ್ಟ್ ರಿಟರ್ನ್ ಟಿಕೆಟ್ ಯಾವಾಗ ಬುಕ್ ಮಾಡ್ಬೋದು ಅಂತ ಯೋಚನೆ ಮಾಡ್ಬೋದಾ? It's about having some kind of an action plan to reduce your own stress levels. Again, relaxation techniques that my dear friend will cover in a lot more detail as to what you need to do. Social support, as I said, is something which we have lost over a period of say decades, is the art of socializing on a personal level. ಈಗಿನ ಕಾಲದಲ್ಲಿ ವಾಟ್ಸ್ಆ್ಯಪ್ ಅಲ್ಲಿ ಎಲ್ಲರಿಗೂ ಲೈಕ್, ಫೇಸ್ಬುಕ್ ಅಲ್ಲಿ ಲೈಕ್ಸ್ ಹೊಡೆಯೋದೇ ಇಸ್ ದ ಕರೆಂಟ್ ಟ್ರೆಂಡ್. ವೆರಸ್ ಅವ್ರ ಎದುರುಗಡೆ ಬಂದಾಗ you have not more than 5, probably 10 minutes of conversation. Then after that, even if you are on the phone, ಆಮೇಲೆ ಇನ್ನೇನಾದ್ರೂ ವಿಷಯ ಇದೆಯಾ? You already tried up that conversation. There isn't anything else that you are able to converse with. Again, tips which I often tell a lot of our patients, and their patients agadik munche, these are some of the preventative entities that you need to kind of consider. But once you have already become into a disorder, you need professional help. At least family members jothe avaga time spend ಮಾಡಿ. Kandita, think about your own strengths and weaknesses. We are not perfect. There are a lot of people around us who can help us out. ತೊಂದರೆ ಇದ್ದಾಗ ಖಂಡಿತ help ಕೇಳಿ. That is not a sign of weakness. Instead, they'll appreciate because you are asking them for something which they are good at. Again, if you are religiously based, this is only to hint that meditation is also very, very useful in reducing stress. And consider having a very, very good physical health also, because there's a lot of evidence pouring out, especially now that your International Yoga Day is also been celebrated. We definitely have lots more to offer when it comes to yoga. Again, at a personal level, eat well, sleep well, have regular exercises, and think about how you can have some good time also. Recreation is very, very important. See, when we were young, we used to go on LTAs. I don't know how many people were part of those going with parents on LTAs. That used to be one annual trip that was absolutely booked, compulsory. Whether we liked it or not, we had to go. How many people go nowadays? Yes, you might be able to travel across the globe, but as a family, with your parents, with your family members, how often do you travel? Especially in the name of vacation. Something which you need to do. But definitely, if you feel after doing all this, you're not getting any respite, seek professional help. There are plenty of professionals around. They can help you. Just a bit about organizational approach, because obviously there are people who manage a lot more people around them. Think about what kind of people, the right people for the right kind of jobs. Even if you are desperate in terms of recruiting anybody, do not pick the wrong person. It's a recipe for disaster. Smart goals, very much specific, measurable, achievable, researched and time specific. So definitely have 7 goal settings. Obviously, if there are people who are getting frustrated with their jobs, do something about redesigning their jobs or redefining their responsibilities or roles. Make it a bit more exciting. Do something. Increase their involvement in doing job descriptions or job reviews rather than sending emails. Definitely call them, have a face-to-face kind of an encounter. Communication. See, again, something which we take for granted. The fact that we don't have English as our mother tongue is the biggest fallacy. So whenever we are communicating, do think about communicating in the language that is comfortable for both parties. See, having been in UK for almost 12 years, I still feel English is a very, very difficult language. And communicating in English is even more hard. So definitely take a lot of precautions when you are communicating. And wellness programs. Nowadays, all MNCs, if not most MNCs, have a lot of these wellness kind of programs. Wherein again, it's become more like a tick box exercise. Have they done health and safety? Have they done coping with stress? I'm sure the stress management is branded across left, right, center, and a lot of non-medicals also do it. But the key is understanding where stress originates and how you deal with stress. Again, these are some of the programs that we have started, because stress is not limited only to physical aspects. ಬಹಳಷ್ಟು ಜನ ಸ್ಮೋಕಿಂಗ್ ಇಟ್ಕೋತಾರೆ, and there are a lot of people who get on to this. How many people know about the units in alcohol? ಎಷ್ಟು ಜನ ಕುಡಿತೀರಾ? ಹೇಳ್ಬೇಡಿ, don't answer. But general rule is Western standards ಅಲ್ಲಿ any kind of individual 7 ದಿನದಲ್ಲಿ in 7 days you should not exceed more than 21 units, and that has to be staggered over a period of 7 days. If you are drinking all 7 days equivalent over a weekend, that also becomes a problem. It's called binge free. But these are some of the common kind of measures. ಅಂದರೆ ನಾವು ಎಷ್ಟು ಕುಡಿತೀವಿ, ಯಾವ ಥರ ಕುಡಿತೀವಿ, everything comes into the picture. But still not a mechanism. Alcohol is a double-edged sword. The first drink will elevate your mood. After that, it will only kind of pull you down. It is the most powerful depressant man has ever invented. ಅದರಲ್ಲಿ ನಿಮ್ಮ ಮನಸ್ಸನ್ನು ಕೆಳಗೆ ಎಳೆಯೋದಕ್ಕೆ, ಡಿಪ್ರೆಷನ್ಗೆ ಆಳಾಗೋದಕ್ಕೆ this is one of the biggest contributors. Definitely doesn't work. So does this. Lot of illicit drugs. Bangalore is supposed to be the South India's capital for illicit drug use. We still don't know who is using it. If they are in trouble, where are they getting all the necessary help? There's very, very few kind of medically run centers where people can go for detoxes. Certainly something which it does not help in the long term. Illicit drugs only, there are a lot of people who abuse prescribed drugs. Zolpidem, Restil, Anxate, halavar medicines. There are people who just use it for years and years. Not useful. Again, you are subjecting yourself for an artificial suppression of your stress response. Not helpful in the long run. Relaxation. Again, Shashikant will cover in much greater detail how yoga can be used as one of the major tools to kind of achieve the relaxation process. Definitely sleep well. Any questions? ಏನಾದ್ರು ಪ್ರಶ್ನೆಗಳಿದೆಯಾ?
You said about the doctor that childhood experience, how people go. So is that a positive thing or a negative thing?
It works both ways. See, someone who is often the kind of stories that we come across is a lack of parental support. See, if they have a good genetic makeup, they are much more good in trying to kind of focus their frustrations onto better things. So they cope with striving for something which they have never achieved. Whereas it can also have the other side of it, which is they are unable to kind of control their own emotions. So it becomes a downside. And they just can't handle any form of stress. So even a minor kind of an argument becomes very overwhelming.
The reverse thing, if a child has never experienced stress, so is that same thing?
That they tend to kind of manage stress much better. Purely because they are constantly kind of having that level of self-confidence. Because if it's not that they won't do mistakes, but at least their approach to a particular problem is much better.
As in if they have never been exposed to
Never been exposed. As in parental support has been very good.
very supported by, when that is more positive.
That is possible. Because the emotional fluctuations are very, very key. Anything else?
You just mentioned about the state where a person, irrespective of the stress, will never be stressful. Jitna bhi dale, so they'll be okay with it. What is that?
Very few people have that much tolerance to kind of stress.
Is it a bad thing?
No, certainly not. It's, see, the gist of the entire talk is how less stressful you can make your body and mind. See, it takes probably years and years of experience for our good old yogis who kind of go there, do that penance and achieve whatever salvation they claim to. It's how they kind of respond to you through any number of calamities, physical, psychological, emotional, anything at them. They are, it's not that they are not perceiving it. The way how they respond to it is very, very different. And that is proven doing a lot of our scientific studies. There are certain yogics, usually our brain works on beta activity, which is around 13 hertz of waves if you do the EEG. These yogics can bring it down from 13 beats per minute, per second, to almost up to as low as 4 beats per second. That is, effectively they are like being comatose. It's not that they are willingly letting a lot of the centers in the brain active, but they are keeping everything under control. So they'll only operate on certain centers that they want to operate. That's the level of control that they have.
So, in a different line, if you think, there are certain people who have selective stress perception. Like some things they'll be like, okay, some things. So is there something?
Again, if it is not affecting their day-to-day activities, it's absolutely fine. A lot of women are scared of spiders. A lot of men are scared of women. But it's okay as long as it's not affecting their day-to-day life.
Is there a bad thing? Should it be looked into or something?
If it is affecting their day-to-day activities, that's the key. If it is affecting any aspect of your functionality in your life, get it done. Because anxiety is not a short-term entity, it becomes long over a period of time. Anything else? Thank you.
Break heavy.
Namaste to all. Welcome back. My name is Dr. Shashikant. I'll just add a little additional information on what Dr. Anand has already spoken. And subsequently we'll be experiencing something unique, that is the technique where whenever you feel stressed, those techniques you can use it. So usually stress involves your nervous system. For that we need to know what kind of systems we are already having. So nervous system usually divides into voluntary nervous system and involuntary nervous system. Voluntary ಅಂದರೆ ಯಾವುದು ನಮ್ಮ ಅಂಟಲ್ಲಿ ಕಂಟ್ರೋಲಲ್ಲಿ ಇದೆ ಅದು voluntary nervous system. ಯಾವುದು raise your hand. So with this suggestion his nervous system responds. He heard the sound and he sent signal to the brain saying that lift the right arm. That is under his voluntary control. We do some practices of involuntary control also. Involuntary controls like heartbeat, breathing, digestion and all other activities what is happening inside is all involuntary. The same involuntary nervous system is again divided into two types. One is parasympathetic nervous system and sympathetic nervous system. Sympathetic nervous system is the one which will act to the stress. What we already discussed, what stress it is. This nervous system makes you respond to the stress. Suddenly when how cobra came in this particular place, what will be your response? On how will you one with the response?
Excitement.
Frightened, kill. Some of you might go and kill it. So you will fight, or some of you run away. So the response, our response again, sympathetic nervous system is responsible. But how both mele or horror mele, your nervous system cools down. Cooling down, relaxation ಏನು ಮಾಡ್ತಲ್ಲ ಅದಕ್ಕೆ ಇನ್ನೊಂದು nervous system, ಅದಕ್ಕೆ ನಾವು parasympathetic nervous system ಅಂತ ಹೇಳ್ತೀವಿ. ಕಾಮನ್ ಆಗಿ ಹೇಳಬೇಕಂದ್ರೆ all these diseases related to the stress are due to imbalance of this nervous system. ತುಂಬಾ ಸಿಂಪಲ್ ಆಗಿ ಹೇಳಬೇಕಂದ್ರೆ ಈ ನರಗಳ ಸಿಸ್ಟಮ್ ಅಲ್ಲಿ ಇಂಬ್ಯಾಲೆನ್ಸ್ ಏರುಪೇರು ಕಾಣ್ತಾ ಇದೆ. ಯಾಕೆ ಒಂದು ನರಗಳ ಸಿಸ್ಟಮ್ ಜಾಸ್ತಿ ವರ್ಕ್ ಮಾಡ್ತಾ ಇದೆ. Sympathetic nervous system is acting too much, overworking or multitasking. So there is a more of a fight or flight response. ಅದೇನಂತ ನೋಡೋಣ. ಇದು ಎರಡು ತರ ಕನೆಕ್ಷನ್ಸ್ ಬರುತ್ತೆ. ಒಂದು ನರಗಳದ್ದು ಮತ್ತೆ ಇಮ್ಯೂನ್ ಸಿಸ್ಟಮ್ ರಿಲೇಟೆಡ್ ಪಾತ್ವೆ, ಇನ್ನೊಂದು ಸಿಂಪಥೆಟಿಕ್ ನರ್ವಸ್ ಸಿಸ್ಟಮ್. ನಾವು ಸಿಂಪಥೆಟಿಕ್ ನರ್ವಸ್ ಸಿಸ್ಟಮ್ ಏನು ಅಂತ ಹೇಳ್ಬೇಕಂದ್ರೆ ಇದು ಎಕ್ಸ್ಪ್ಲೈನ್ ಮಾಡಿದೆ. ಆ ಸಿಂಪಥೆಟಿಕ್ ನರ್ವಸ್ ಸಿಸ್ಟಮ್ ಏನು ಮಾಡುತ್ತೆ, ನೀವು ಯಾವುದೇ ಸ್ಟ್ರೆಸಸ್ ಇರಲಿ, ವಾಟ್ ಎವರ್ ಸ್ಟ್ರೆಸಸ್ ಯು ಹ್ಯಾವ್, ವರ್ಕ್ ಸ್ಟ್ರೆಸ್ ಇರ್ಬೋದು, ಫ್ಯಾಮಿಲಿ ಸ್ಟ್ರೆಸ್ ಇರ್ಬೋದು, ಫೈನಾನ್ಷಿಯಲ್ ಸ್ಟ್ರೆಸ್ ಇರ್ಬೋದು, any other stresses, it will trigger some chemical reaction by stimulating small glands just above the kidney called as adrenals. Adrenals antele glands barutte 10 by 6 by 3 centimeter size. So that is the one which will make you produce this stress hormone. Stress hormone ಆದ ತಕ್ಷಣ ಏನೇನು ಆಗುತ್ತೆ ನಾವು ಆಲ್ರೆಡಿ ನೋಡಿದ್ವಿ. ಹಾರ್ಟ್ ರೇಟ್ ಜಾಸ್ತಿ ಆಗುತ್ತೆ, ಅಲರ್ಟ್ನೆಸ್ ಜಾಸ್ತಿ ಆಗುತ್ತೆ, ಉಸಿರಾಟ ಜಾಸ್ತಿ ಆಗುತ್ತೆ, ಮಸಲ್ ಟೆನ್ಷನ್ will increase, ಬ್ಲಡ್ ಗ್ಲೂಕೋಸ್ ಜಾಸ್ತಿ ಆಗುತ್ತೆ. So these are all responses due to that particular pathway. ಇನ್ನೊಂದು ಪಾತ್ವೆ ಏನಂದ್ರೆ ಅದೇ ಅಡ್ರಿನಲ್ ಗ್ಲ್ಯಾಂಡ್ಸ್ ಕಾರ್ಟಿಸಾಲ್ ಅಂತ ಹಾರ್ಮೋನ್ ಬಿಡುತ್ತೆ. ಆ ಕಾರ್ಟಿಸಾಲ್ ಹಾರ್ಮೋನ್ ನಿಮ್ಮ ಇಮ್ಯುನಿಟಿನ ಸ್ವಲ್ಪ ಕಡಿಮೆ ಮಾಡುತ್ತೆ. ಇದರ ಪ್ರಕಾರ ಏನು ಅನ್ಕೋಬೇಕಂದ್ರೆ ದೋಸ್ ಪೀಪಲ್ ಹೂ ಆರ್ ಹ್ಯಾವಿಂಗ್ ಮೋರ್ ಸ್ಟ್ರೆಸಸ್ ಇನ್ ದೇರ್ ಲೈಫ್, ದೇ ಟೆಂಡ್ ಟು ಹ್ಯಾವ್ ಇನ್ಫೆಕ್ಷನ್ಸ್, ಮೋರ್ ಅಪ್ಪರ್ ರೆಸ್ಪಿರೇಟರಿ ಇನ್ಫೆಕ್ಷನ್ ಆಗ್ಬೋದು. ಎಲ್ಲ ಗ್ರೂಪ್ ಅಲ್ಲಿ ಯಾರು ಜಾಸ್ತಿ ಸ್ಟ್ರೆಸ್ ಇರ್ತಾರಲ್ಲ ಅವರಿಗೆ ಕಾಮನ್ ಆಗಿ ಕಾಮನ್ ಕೋಲ್ಡ್ಸು, ಫೀವರ್ಸು ಆನ್ ಅಂಡ್ ಆಫ್ ಬರುತ್ತೆ. ದಟ್ಸ್ ದ ಸಿಂಪ್ಲೆಸ್ಟ್ ಸೈನ್ ದಟ್ ಯುವರ್ ಇಮ್ಯುನಿಟಿ is compromised due to the stress. Okay, so these two pathways are usually involved. Rather than too technical, I'll go with this one way. Autonomic nervous system ಅಂದ್ರೆ ಯಾವುದು ಇನ್ವಾಲ್ವ್ಮೆಂಟ್ ಇದೆ, ಯಾವುದು ನಮ್ಮ ಕಂಟ್ರೋಲ್ ಅಲ್ಲಿ ಇಲ್ಲ, that is called autonomic nervous system. Now ವರ್ಲ್ಡ್ ವ್ಯೂ ಅಲ್ಲಿ ಸ್ಟ್ಯಾಟಿಸ್ಟಿಕ್ಸ್ ಅಲ್ಲಿ ಯಾವಾಗಲೇ ಯಾರು ಕೇಳ್ತಿದ್ರು ಸ್ಟ್ಯಾಟಿಸ್ಟಿಕ್ಸ್ ಏನಂದ್ರೆ ಎಷ್ಟು ಜನ ಜಗತ್ತಲ್ಲಿ ಸ್ಟ್ರೆಸ್ ಇಂದ ಪೀಡಿತರಾಗಿದ್ದಾರೆ, ಹೌ ಮೆನಿ ಪೀಪಲ್ ಇನ್ ದಿಸ್ ವರ್ಲ್ಡ್ ಆರ್ ಟ್ರಬಲ್ಡ್ ಡ್ಯೂ ಟು ದಿ ಸ್ಟ್ರೆಸ್. NIH ಸ್ಟ್ಯಾಟಿಸ್ಟಿಕ್ಸ್ ಏನು ಹೇಳುತ್ತೆ, ನ್ಯಾಷನಲ್ ಇನ್ಸ್ಟಿಟ್ಯೂಟ್ ಆಫ್ ಹೆಲ್ತ್ USA ಸ್ಟ್ಯಾಟಿಸ್ಟಿಕ್ಸ್ ಏನು ಹೇಳುತ್ತೆ, 70% ಆಫ್ ಪೀಪಲ್ ಹೂ ಆರ್ ಹ್ಯಾವಿಂಗ್ ಎನಿ ಇಶ್ಯೂಸ್, ಎನಿ ಹೆಲ್ತ್ ಇಶ್ಯೂಸ್, 70% ಆಫ್ ಪೇಷಂಟ್ಸ್ ಹೂ ಆರ್ ಗೋಯಿಂಗ್ ಟು ವಿಸಿಟ್ ಫಸ್ಟ್ ಟೈಮ್ ಡಾಕ್ಟರ್ ಹತ್ರ ಹೋಗ್ತಾರೆ ಏನೇ ಹೆಲ್ತ್ ತೊಂದರೆಗಳಿಂದ, 70% ಜನಗಳಿಗೆ ಸ್ಟ್ರೆಸ್ ರಿಲೇಟೆಡ್ ಸಿಂಪ್ಟಮ್ಸ್ ಇದೆ. Staggering high statistical rate saying that 70% of your usual issues, common issues, headache, back pain, acidity related symptoms, sleeplessness, these are very few common symptoms related to the stress. 70% is ತುಂಬಾ ಜಾಸ್ತಿ ಇದೆ. 70% itself says that okay, if we are able to prevent this stress, we can prevent 70% of issues related with health even before going to the doctor. Ultimate aim of the program is just this, that we want you to take up health in your hand, try to prevent as diseases as much as possible. So ultimately ಈಗ ಒಂದು ನರಗಳ ಸಿಸ್ಟಮ್ ಜಾಸ್ತಿ ವರ್ಕ್ ಆಗ್ತದೆ, ದಟ್ ಇಸ್ ಎ ಇಂಪೇರ್ಮೆಂಟ್. ತುಂಬಾ ಈಗ ಒಂದು ಸಿಂಪಲ್ ಡೀಟೇಲ್ಸ್ ಇದೆ ಅಲ್ಲಿ. ಸಿಂಪಥೆಟಿಕ್ ಆಕ್ಟಿವಿಟಿ ಆದ್ರೆ ಏನಾಗುತ್ತೆ, ಕಂಟ್ರೋಲ್ ಡೈಲೆಕ್ಟ್ ಆಗುತ್ತೆ, ಯಾಕಂದ್ರೆ ಅಲರ್ಟ್ನೆಸ್ ಜಾಸ್ತಿ ಬೇಕು. ಯಾವ್ದು ಅಲರ್ಟ್ನೆಸ್ ತುಂಬಾ ಜಾಸ್ತಿ, ಸ್ಟ್ರೆಸ್ ರೆಸ್ಪಾನ್ಸ್ ತುಂಬಾ ಜಾಸ್ತಿ ಇರುತ್ತೆ, ಅವ್ರಿಗೆ ನಿದ್ದೆ ಬರಲ್ಲ. ತುಂಬಾ ಅಲರ್ಟ್ನೆಸ್, ಹೈಪರ್ ಸೆನ್ಸಿಟಿವ್, ಇಷ್ಟು ಒಂದು ವಿಷಯ ಹೇಳಿದ್ರೆ ದೇ ವಿಲ್ ಬಿ ವೆರಿ ವೆರಿ ಸೆನ್ಸಿಟಿವ್. ಸೊ ಸೆನ್ಸಿಟಿವಿಟಿ ಆಫ್ ದ ಪೀಪಲ್ ಇಸ್ ಇನ್ಕ್ರೀಸಿಂಗ್, ಬಟ್ ದ ರೆಸ್ಪಾನ್ಸ್ to that sensitivity or managing that sensitivity or coping with that sensitivity is reducing. Salivation,
ಬಾಯಿ ಒಣಗುತ್ತೆ ಕಾಮನ್ ಆಗಿ. ಲೈಕ್ ದಟ್ ದೇರ್ ಆರ್ ಅದರ್ ಥಿಂಗ್ಸ್. ಹಾರ್ಟ್ ರೇಟ್ ಜಾಸ್ತಿ ಇರುತ್ತೆ, ಹಾರ್ಟ್ ಬೀಟ್ ಜಾಸ್ತಿ ಇರುತ್ತೆ, ಬ್ಲಡ್ ಗ್ಲೂಕೋಸ್ ಜಾಸ್ತಿ ಇರುತ್ತೆ, ಅಡ್ರಿನಲ್ ಹಾರ್ಮೋನ್ಸ್ ಜಾಸ್ತಿ ಇರುತ್ತೆ, ಡೈಜೆಷನ್ ಕಡಿಮೆ ಆಗುತ್ತೆ. ಯಾಕಂದ್ರೆ ಫೈಟ್ ಆರ್ ಫ್ಲೈಟ್ ಮಾಡಬೇಕಾದ್ರೆ your muscles need more strength, so there will be more pooling of blood towards the muscles and less towards the digestive system. So stress related issues also starts with constipation, acidity and all these things. So relaxed bladder, you feel like going for toilet and you feel anxious, you know? So opposite of that is a relaxation response. So what we are already discussing until now is what is stress and how it affects. So that is in a common point what we call stress response. So what ultimately we want you to achieve is relaxation response. ಎರಡು ನರ್ವಲ್ ಸಿಸ್ಟಮ್ ಅಲ್ಲಿ ಒಂದು ನರ್ವಲ್ ಸಿಸ್ಟಮ್ ಜಾಸ್ತಿ ವರ್ಕ್ ಆಗ್ತದೆ, ಇನ್ನೊಂದು ನರ್ವಲ್ ಸಿಸ್ಟಮ್ಗೆ ನಾವು ಜಾಸ್ತಿ ವರ್ಕ್ ಮಾಡಬೇಕು. ಅಂದರೆ ಕೋಪಿಂಗ್ ಸ್ಕಿಲ್ಸ್ನ ಬೆಳೆಸಬೇಕು. ಒಂದು ಎಕ್ಸಾಂಪಲ್ ಕೇಳ್ತೀನಿ, ವಿಲ್ ಡು ಒಂದು ಸ್ಮಾಲ್ ವರ್ಕಪ್. I ask you to take a deep breath in and hold your breath. Take a deep breath in. Hold. I request you to hold your breath as long as possible, as much as possible. Let me talk, let me observe you holding breath. Just like that. Holding breath. Holding. Maybe. Still holding? No. So, until one point, your voluntary nervous system is doing this activity of holding the breath. But beyond that, your nervous system takes over. So, breath is the only tool to work on the stress initially. Can you control your heart rate?
No.
Can you control after I swallow some food, it goes out. I feel food, I don't like the food, I want it to come back. It will not come back. So once it is done, involuntary process, it cannot reverse unless it is pathological. Vomit ಆದರೆ ಮಾತ್ರ ಬರುತ್ತೆ. That your will, it will not come out. But breathing is the only thing, we call it as a door to the autonomic nervous system. By regulating the breathing, you can work on these stress issues. ತುಂಬಾ ಇಂಟ್ರೆಸ್ಟಿಂಗ್ ಆಗಿರೋ this explanation will do some relaxation methods. ಎಲ್ಲ ನಾವು ಮಾತಾಡಿದಷ್ಟರಲ್ಲಿ ಒಂದೇ ಪಿಕ್ಚರಲ್ಲಿ ಕೋಪಿಂಗ್ ಆಗಿದೆ. So only one picture we can see. Stress ಆ ವ್ಯಕ್ತಿ ಪಿಕ್ಚರ್ ಅಲ್ಲಿ ಸ್ಟ್ರೆಸ್ ಜಾಸ್ತಿ ಆಗಿದೆ. ಏನೇನಾಗುತ್ತೆ ನೋಡಿ, ಫೈಟ್ ಮತ್ತೆ ಫ್ಲೈಟ್ ರೆಸ್ಪಾನ್ಸ್. ಫೈಟ್ ಮಾಡ್ತಾನೆ ಅಥವಾ ಓಡೋಗ್ತಾನೆ, ಎರಡು ರೆಸ್ಪಾನ್ಸ್ ಆಗ್ಬೋದು. ಆ ರೆಸ್ಪಾನ್ಸ್ ಆಗುವವರೆಗೆ ಸಿಂಪಥೆಟಿಕ್ ನರ್ವಸ್ ಸಿಸ್ಟಮ್ ಇಸ್ ವರ್ಕಿಂಗ್, ಸೆಕ್ರೆಟಿಂಗ್ ಮೋರ್ ಸ್ಟ್ರೆಸ್ ಹಾರ್ಮೋನ್ಸ್. ಆ ರೆಸ್ಪಾನ್ಸ್ ಹೋದ್ಮೇಲೆ ಇಫ್ ಇಟ್ ಇಸ್ ಶಾರ್ಟ್ ಟರ್ಮ್ ನಾರ್ಮಲ್ ಆಗಿ ಬರ್ತೀರಿ, ಬಾಡಿ ವಿಲ್ ರಿಕವರ್. ಬೇರೆ ಒಂದು ನರ್ವಸ್ ಸಿಸ್ಟಮ್ ಇರುತ್ತಲ್ಲ ರಿಲ್ಯಾಕ್ಸೇಷನ್ ಮಾಡೋಕ್ಕೆ, ಅದು ವರ್ಕ್ ಮಾಡುತ್ತೆ, ಮತ್ತೆ ನೀವು ನಾರ್ಮಲ್ ಬರ್ತೀರಿ. ಅದು ನಾರ್ಮಲ್ ಡೇ ಟು ಡೇ ಸ್ಟ್ರೆಸ್. ಒಂದು ದಿವಸದಲ್ಲಿ, ಎರಡು ದಿವಸದಲ್ಲಿ, ಮೂರು ದಿವಸದಲ್ಲಿ ಕಡಿಮೆ ಆಗುತ್ತೆ. ಸೊ ವಿ ಕಾಲ್ ನಾರ್ಮಲ್ ಒನ್ ಡೇ ಟು ಡೇ ಸ್ಟ್ರೆಸ್ಸಸ್. ಸ್ಟ್ರೆಸ್ ಅಂದರೆ ಯೂಶಲಿ ಯಾವ್ದು ಅಂತ ಅನ್ಕೋಬೇಕು, ಡೇ ಟು ಡೇ ಸ್ಟ್ರೆಸ್ಸಸ್ ಇರುತ್ತೆ. ಇಫ್ ನಾಟ್ ಮೂರನೇದಲ್ಲಿ ನೋಡಿದ್ರೆ ಫೈಟು, ಫ್ಲೈಟು ಮತ್ತು ಮೂರನೇದಿದೆ ಕೋಪಿಂಗ್. ನಿಮ್ಗೆ ಯಾವ್ದಾದ್ರು ಸ್ಕಿಲ್ಸ್ ಗೊತ್ತಿದ್ರೆ ಸ್ಟ್ರೆಸ್ ಕಡಿಮೆ ಮಾಡ್ಕೊಳಕ್ಕಾಗಲ್ಲ. ನಾವೆಲ್ಲ ಎಲ್ಲ ಬಿಟ್ಟು ಫಾರೆಸ್ಟ್ಗೆ ಹೋಗೋಕ್ಕಾಗಲ್ಲ, ವರ್ಕ್ ಮಾಡ್ತಾ ಇರಬೇಕು, ವರ್ಕ್ ಸ್ಟ್ರೆಸ್ ಇದ್ದೇ ಇರುತ್ತೆ. ಇಫ್ ಯು ಹ್ಯಾವ್ ಸಮ್ ಟೆಕ್ನಿಕ್ಸ್ ಟು ಕೋಪ್ ಅಪ್ ದಟ್ ವಿಲ್ ಬಿ ಲರ್ನಿಂಗ್ ನೌ. If you have those techniques to relax more, so you can ease this very well by washing out all the stress hormones easily. That is the coping part. If not, the stress again cumulative stress we call this. Normal stress, cumulative stress. Cumulative stress ಅಂದ್ರೆ ಒಂದು ಸ್ಟ್ರೆಸ್ ಆದ್ಮೇಲೆ ಇನ್ನೊಂದು ಸ್ಟ್ರೆಸ್, ಒಂದು ಸ್ಟ್ರೆಸ್ ಆದ್ಮೇಲೆ ಇನ್ನೊಂದು ಸ್ಟ್ರೆಸ್, ಹಂಗೆ ಆಗ್ತಾನೆ ಇದೆ. ಎಷ್ಟೋ ತಿಂಗಳವರೆಗೆ, ಮಂತ್ಸ್ವರೆಗೆ, ವರ್ಷಗಳವರೆಗೆ ಆಗ್ತಾನೆ ಇದೆ. ಸೊ ಕ್ಯುಮ್ಯುಲೇಟಿವ್ ಅದಾದ್ಮೇಲೆ ನಾನು ರೆಸ್ಪಾಂಡ್ ಮಾಡಕ್ ಬರ್ತಾ ಇಲ್ಲ. ಸೊ ಇಟ್ ಈಸ್ ಐದರ್ ಫಿಲ್ ಇನ್ ಮೈ ಹೆಡ್ ಇನ್ ದ ಫಾರ್ಮ್ ಆಫ್ ನಂಬರ್ ಆಫ್ ಥಾಟ್ಸ್, ಆರ್ ಇಟ್ ಈಸ್ ಅಫೆಕ್ಟಿಂಗ್ ಮೈ ಬಾಡಿ ಇಂಡೈರೆಕ್ಟ್ಲಿ ಆರ್ ಡೈರೆಕ್ಟ್ಲಿ. ಅದಕ್ಕೆ ನಾವು ಎಕ್ಸಾಕ್ಷನ್ ಫೇಸ್ ಅಂತೀವಿ. ಎಲ್ಲ ವರ್ಕ್ ನಮ್ಮ ಬಾಡಿ ಒಂಥರ ರಿಸೋರ್ಸ್ ಇದೆ. ಸ್ಟ್ರೆಸ್ ಬಂದ್ಮೇಲೆ ನಮ್ಮ ಬಾಡಿ ರೆಸ್ಪಾಂಡ್ ಮಾಡ್ತಾ ಇದೆ, ಮೆಂಟಲಿ ಅಥವಾ ಫಿಸಿಕಲಿ ರೆಸ್ಪಾಂಡ್ ಮಾಡಿ ಒಂದು ಲೆವೆಲ್ ವರೆಗೆ ರೆಸ್ಪಾಂಡ್ ಮಾಡ್ತಾ ಇದೆ. Beyond that point, it will get exhausted. Exhaust ಅಂದ್ರೆ ಏನು, ನಮ್ಮ ಸ್ಟ್ರೆಸ್ ಪ್ರೆಷರ್ ಜಾಸ್ತಿ ಇದೆ ಬಟ್ ಬಾಡಿ ರಿಸೋರ್ಸ್ ಕಡಿಮೆ ಆಗಿದೆ. ಪ್ರೆಷರ್ ಜಾಸ್ತಿ ಇದೆ, ರಿಸೋರ್ಸ್ ಕಡಿಮೆ ಆಗಿದೆ. ಸಿಂಪಲ್ ವೇ ಆಫ್ ಅಂಡರ್ಸ್ಟ್ಯಾಂಡಿಂಗ್. ಪ್ರೆಷರ್ ಜಾಸ್ತಿ ಇದೆ, ರಿಸೋರ್ಸಸ್ ಕಡಿಮೆ ಆಗಿದೆ. ರಿಸೋರ್ಸಸ್ ಕಡಿಮೆ ಆದ ತಕ್ಷಣ ವಿಲ್ ಗೆಟ್ exhausted. Exhaustion in the sense the resources of your body are not enough to face this stress. Once there is exhaustion, then the disease starts. There is a work of doctors. After that, a disease ಬಂದ ಮೇಲೆ ಡಾಕ್ಟರ್ಗಳ ಕೆಲಸ. ನಾವು ಈ ಕ್ಲಾಸ್ಗಳ ವರ್ಕ್ಶಾಪ್ ಉದ್ದೇಶ ಅಂದರೆ ಡಿಸೀಸ್ ಬರಕ್ಕೆ ಬಿಡಬಾರ್ದು. Even before disease comes, we want to work on this in the form of preventive medicine. ಇದು ಈಸಿ ಇದೆಲ್ಲ, ಅಂಡರ್ಸ್ಟ್ಯಾಂಡಿಂಗ್ ಈಸಿ ಇದೆಲ್ಲ. So we want those stress or coping skills to be developed. That's it. And beyond this, disease prevention should happen. ಇವೊಂದು ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡೋಣ. ಇದೊಂದು ಕೋಪಿಂಗ್ ಸ್ಕಿಲ್ಸ್. ಅದಕ್ಕಿಂತ ಮುಂಚೆ ನಾನು ಇನ್ನೂ ಒಂದೇ ಹೇಳಬೇಕು. ಯೋಗದಲ್ಲಿ ಒಂದು we define 5 different bodies. Yoga defines 5 different bodies, 5 different existences. One is the physical body. ಅಂದ್ರೆ ಸ್ಥೂಲ ಶರೀರ ಏನಿದೆ, ಫಿಸಿಕಲ್ ಬಾಡಿ. ಅನ್ನಮಯ ಕೋಶ ಅಂತ ಹೇಳ್ತೀವಿ. ಅನ್ನದಿಂದ ಮಾಡಲ್ಪಟ್ಟಂತ ಬಾಡಿ, ನಮಗೆ ಕಾಣುತ್ತಲ್ಲ ಬಾಡಿ. It's a physical body first. Second, vital body, pranamaya kosha. Heart is beating, breathing is happening, food is getting digested, kidneys are functioning. Every cells have a metabolic activity. Some amount of prana is there in all the areas. So that is the prana body. Third one is manas, manomaya kosha. Emotions. All of us have different set of emotions. Somebody have more emotions, more response. Indians have much more response, emotional response compared to West. Manas, manomaya kosha. Annamaya, Pranamaya, Manomaya. Physical body, vital body, emotional body. Fourth one is intellectual body. I want your intellectual body to understand this concept and then work on. Identify and identify madake I'm trying to guess this. So intellectual, nanna buddhi shakti vijnana. Vijnananta nanu understand madutunde. I understand vijnana my question. Last one is bliss body. Everyone in this life wants to be happy and avoid misery. Sukha prapti, dukha nivritti. Ella they are anybody belongs to any religion, any caste, any creed, any race wants to be happy in this world and avoid misery. Correct? So these 5 elements usually holds good in the yogic context and at the same time modern medical context. What we are focusing is physical body is the only thing which all of us doctors are seeing. Ena tondre idya illeste nodtira, blood test ಮಾಡ್ತೀರಾ, we are talking of the body. What questionnaires we are given is just to check the mind. Third, mind lena tondre ide. If you answer honestly, we can get to know those contents. If somebody is more anxious, somebody is more depressed, we are trying to work on this. So physical body is one which we usually focus, all of us will focus. Next is psychology and psychiatry, which focus on the mind and emotions. So recent 400 to 500 years ಅಲ್ಲಿ the mind is also important in causing disease. ಏನಾದರೂ ತುಂಬ ಸ್ಟ್ರೆಸ್ಫುಲ್ ಆದರೆ full day I will be exhausted body. I don't feel like eating it. My eyes will be burning. I will be having a headache. So mind is also important. So with this understanding of this context, what exercise I'll be teaching you now is mainly for the mind to let out your emotions, to bring a catharsis, and for the vital body prana to increase your vital capacity to cope up with the stress. Marana, we'll do a technique. It is a very complex technique. I combine yoga aspects, psychology aspects, focusing aspects, and auto suggestion aspects in this. So we'll use this and use some mudras to do this particular practice. Hold your hands like this. Left hand to right. Thumbs up. Other 4 fingers you are holding like this. Hold this tight. Release your lower 4 fingers. Cover your knuckle area like this. Thumb touching the middle finger. Or if not, you can hold like this also, no problem. Then tilt, you can touch it to the chest. Shankha Mudra. I want to use some of the mudras because I want to use some hand gesture to make your mind focused onto that. Okay. Psychologically, it is a one-pointed focus. I want your mind to focus on that particular tingling sensation what you are having around the finger. ಆ ಏರಿಯಾದಲ್ಲಿ ಫೋಕಸ್ ಮಾಡಬೇಕು. ಬೆರಳು ಏನು ರಕ್ತ ಸಂಚಲನೆ ಗೊತ್ತಾಗ್ತದೆ ನಮಗೆ, ಅಲ್ಲಿ ಫೋಕಸ್ ಮಾಡಬೇಕು. ಫೋಕಸ್. ಸೊ ಐ ಸೆಟ್ ಬ್ರೀದಿಂಗ್ ಇಸ್ ಅ ಡೋರ್ ಟು ದ autonomic nervous system, or breathing is a door to the involuntary nervous system. ನಿಮಗೆ ಯಾವುದೇ ಸದ್ಯಕ್ಕೆ ಯಾವುದೇ ಡಿಸೀಸ್ ಇರ್ಬೋದು ಇಲ್ಲದೆ ಇರ್ಬೋದು, ಸೊ ವಿ ಆರ್ ಇನ್ ದಿಸ್ ಪ್ರೊಸೆಸ್ ಬಿಫೋರ್. ಆ ಸ್ಟ್ರೆಸ್ ಹಾರ್ಮೋನ್ಸ್ನ ವಾಶ್ ಔಟ್ ಮಾಡೋಕ್ಕೋಸ್ಕರ ಐ ವಾಂಟ್ ಟು ಯೂಸ್ ದಿಸ್ ಟೆಕ್ನಿಕ್, ರೆಗ್ಯುಲರ್ ಬ್ರೀದಿಂಗ್. ಇನ್ನೊಂದು ಎಕ್ಸಾಂಪಲ್, ನಾವು ತುಂಬಾ ಬೇಜಾರಾಗಿರ್ಬೇಕಾದ್ರೆ, ತುಂಬಾ ದುಃಖ ಆಗಿರ್ಬೇಕಾದ್ರೆ, ತುಂಬಾ ಸಿಟ್ಟು ಬರ್ಬೇಕಾದ್ರೆ ಉಸಿರಾಟ ಯಾವ ತರ ಇರುತ್ತೆ? ಏರ್ ಬೇರೆ ಇರುತ್ತೆ, ಫಾಸ್ಟ್ ಇರುತ್ತೆ, ಶಾರ್ಟ್ ಇರುತ್ತೆ, ಇರಾಟಿಕ್ ಆಗಿರುತ್ತೆ. ತುಂಬಾ ರಿಲ್ಯಾಕ್ಸ್ ಆಗಿ ಕಾಮ್ ಆಗಿರ್ಬೇಕಂದ್ರೆ ಉಸಿರಾಟ ನಾರ್ಮಲ್ ಆಗಿರುತ್ತೆ. ಸೊ ದೇರ್ ಇಸ್ ಅ ಡೆಫಿನೆಟ್ ಲಿಂಕ್ ಬಿಟ್ವೀನ್ ಬ್ರೀದಿಂಗ್ ಅಂಡ್ ದ ಇಮೋಷನ್ಸ್. ಸೊ ಮೈ ಹೈಪೋಥೆಸಿಸ್ ಇಸ್ ಐ ಯೂಸ್ ಬ್ರೀದಿಂಗ್ ಇನ್ ಅ ರೆಗ್ಯುಲೇಟೆಡ್ ಪ್ಯಾಟರ್ನ್. 4 ಸೆಕೆಂಡ್ ಉಸಿರು ತಗೋಬೇಕು, 4 ಸೆಕೆಂಡ್ ಉಸಿರು ಇಟ್ಕೋಬೇಕು, 4 ಸೆಕೆಂಡ್ ಬಿಡಬೇಕು. 4 seconds breathing in, 4 seconds hold the breath, 4 seconds exhalation. When you are doing this technique, mind is held on to the awareness of the 4 seconds, 4 seconds, 4 seconds. So it will not think of the future, it will not think of the past. So mind is in a present moment and happiness. Happiness is you are there now. Hold like this, keep your eyes closed. 4 seconds breathing in, 4 seconds hold the breath, 4 seconds exhalation. 4 seconds उसे तगोबेको, 4 seconds इट्कोबेको, 4 seconds बिडबेको. 4 seconds सांस लेना है, 4 seconds सांस को रोकना है, 4 seconds सांस को छोड़ना है. Keep doing this. If you are doing this technique right, you are not going to get any thoughts. If you are doing this technique wrong, you will be able to think anything outside. So try this. ಉಸಿರು ತಗೋಬೇಕು, ಉಸಿರು ಹಿಡ್ಕೋಬೇಕು, ಉಸಿರು ಬಿಡಬೇಕು ಮಾಡ್ತಾರೆ. Keep your eyes focused, inner eye focused onto the tingling sensation what you are getting at the level of your hands. So this is our take home relaxation breathing technique what you are going to do. Breathe in 4 seconds, hold the breath 4 seconds, breathe out 4 seconds. Keep doing. If you are subtle enough, notice your heartbeat. With your breathing, heartbeat also responds by little increase in your heartbeat. Do you feel? ಉಸಿರಾಟ ನೀವು ಮಾಡ್ಬೇಕಂದ್ರೆ ಈ ಪದ್ಧತಿ 4 ಸೆಕೆಂಡ್ ಉಸಿರು ತಗೊಳ್ಳೋದು, 4 ಸೆಕೆಂಡ್ ಇಟ್ಕೊಳ್ಳೋದು, 4 ಸೆಕೆಂಡ್ ಬಿಡೋದು. ನಿಮ್ಮ ಹೃದಯದ ಬಡಿತ ಸ್ವಲ್ಪ ಜಾಸ್ತಿ ಆಗುತ್ತೆ. ನೋಟಿಸ್ ಮಾಡಿದ್ರೆ slowly and gently stop the practice. Stop the practice. Very slowly release your hands. Do you feel little tingling sensation of heat between your hands? ಕೈ ಮಧ್ಯದಲ್ಲಿ ಸ್ವಲ್ಪ ಶಾಖ ಅನಿಸುತ್ತಾ? ನೋವು ಕಾಣಿಸುತ್ತೆ is a focusing technique. I want to elicit some body's response and create focus. ಆ focus ಗೋಸ್ಕರ ನಾನು ಇದು ಮಾಡ್ತೀನಿ. So when you are having pain, indirectly you are utilizing the stress hormones. So stress levels will be brought down. So take home is like a medicine. 4-4-4 breathing technique with Shankha Mudra or any other mudra. Somebody is having a headache, I use back pain area. Somebody is having back pain, I use Vedanta Mudra. Thumbs up. You are stretching it more and you are creating little pain area here. So pain going from the back to the brain, you are trying to prevent by creating pain going from the hands to the brain. And for temporarily, maybe 2 to 6 hours, brain will forget about back or knee or other. Shankha Mudra, 4-4-4 breathing technique. 4-4-4 ಗೆ ಒಂದು ಅಂತ only hold. If not, you can just hold like this also. This is also an anger control technique. I have ತುಂಬಾ ಸಿಟ್ಟು ಬರ್ತದೆ. Just hold like this, very tight, very tight. Okay, you are dissociating. So it's a beautiful combination. It looks like a more yogic terms, but more medical terms is number of receptors are maximum in your hands compared to any part of your body. As a science, neuroscience says that number of receptors are more. ನಮ್ಮ ದೇಹಕ್ಕೆ ಸಂವೇದನೆಗಳು ಕಳಿಸೋದು ಕೈಯಲ್ಲಿ ಜಾಸ್ತಿ ಬಟನ್ಸ್ಗಳಿವೆ. ಪೇನ್ ಆಗಲಿ, ಹೀಟ್ ಆಗಲಿ, ಕೋಲ್ಡ್ ಆಗಲಿ, ಪೊಸಿಷನ್ ಸೆನ್ಸ್ ಆಗಲಿ. ಕಣ್ಣು ಮುಚ್ಚಿದ್ರೆ ಬಾಡಿ ಹೀಗೆ ಮಾಡಿದ್ರೆ ನಮ್ಮ ಬೆರಳು ಮೇಲಿದೆ ಅಂತ ಗೊತ್ತಾಗುತ್ತೆ. ಪೊಸಿಷನ್ ಸೆನ್ಸ್ ಆಗಲಿ, ಟಚ್, ಪೇನ್, ಫೈನ್ ಟಚ್, ನೀವು ಯಾರಾದ್ರು ಬಂದು ನಿಮಗೆ ಹೊಡೆಯೋತರ ಇಟ್ಕೊಂಡ್ರೆ ಗೊತ್ತಾಗುತ್ತೆ. ಜೆಂಟಲ್ ಟಚ್ ಮಾಡಿದ್ರೆ ಗೊತ್ತಾಗುತ್ತೆ. ಅವರ್ ಬಾಡಿ ಈಸ್ ಸೋ ಮಚ್ ಇವಾಲ್ವ್ಡ್ ಟು ರಿಸೀವ್ ದಿಸ್ ಟಚ್. ಯಾವುದೇ ಟಚ್ ಇದ್ರೂ so that is the heightened sensitivity level of us. 4-4-4 breathing technique plus Shankha Mudra. 4-4-4 na 1 ಅಂತ ಅನ್ನ ಈ ತರ 20 times morning, 20 times evening for first 1 month. 4 ಸೆಕೆಂಡ್ ಉಸಿರು ತಗೋಬೇಕು, 4 ಸೆಕೆಂಡ್ ಹಿಡ್ಕೋಬೇಕು, 4 ಸೆಕೆಂಡ್ ಬಿಡಬೇಕು. 20 ಸಲ ಬೆಳಿಗ್ಗೆ, 20 ಸಲ ಸಾಯಂಕಾಲ, ಫಸ್ಟ್ 1 month. 1 month ಆದ್ಮೇಲೆ ನಾನು ಅಲ್ಟಿಮೇಟ್ಲಿ ಐ ವಾಂಟ್ ಟು ವರ್ಕ್ ಆನ್ ಯುವರ್ ಪ್ರಿವೆನ್ಷನ್. ಉಸಿರಾಟದ ಕೆಪಾಸಿಟಿ ಜಾಸ್ತಿ ಮಾಡೋದು, ಲಂಗ್ ವಾಲ್ಯೂಮ್ ಐ ವಾಂಟ್ ಟು ಇನ್ಕ್ರೀಸ್, ಆರ್ ಪೀಕ್ ಫ್ಲೋ ರೇಟ್ ಅಂತ ಹೇಳ್ತೀವಿ. ಉಸಿರು ತಗೊಳ್ಳೋ ರೀತಿ ಮತ್ತು ಉಸಿರು ಬಿಡುವಂಥ ರೀತಿ. ಒಂದು ಅಂದಾಜು ಅಂದರೆ ಒಂದು 280ರಿಂದ 300 ml ಉಸಿರು ತಗೊಳ್ತೀವಿ, ಅಷ್ಟೇ ಬಿಡ್ತೀವಿ. ಯಾರು ತುಂಬ ಅಥ್ಲೀಟ್ಸ್ ಆಗಿದ್ರೆ ಅದು ಉಸಿರಾಟದ ಗತಿ ಜಾಸ್ತಿ ಇರುತ್ತೆ. ಲಂಗ್ ವಾಲ್ಯೂಮ್ ಅರೌಂಡ್ 1.3 ಲೀಟರ್ 1.7 ಲೀಟರ್ ಆಗಿರ್ಬೋದು. ಸೊ ನೆಕ್ಸ್ಟ್ ಮಂತ್ ಏನು ಮಾಡಬೇಕಂದ್ರೆ 6 ಸೆಕೆಂಡ್ ಉಸಿರು ತಗೋಬೇಕು, 4 ಸೆಕೆಂಡ್ ಇಟ್ಕೋಬೇಕು, 6 ಸೆಕೆಂಡ್ ಇಟ್ಬಿಡ್ಬೇಕು, 6 ಸೆಕೆಂಡ್ ಬ್ರೀದಿಂಗ್ ಇನ್, 4 ಸೆಕೆಂಡ್ ಹೊಡ್ತಾರೆ, 6 ಸೆಕೆಂಡ್ಸ್ ಎಕ್ಸಲೇಷನ್. ಸೇಮ್ ವೇ 6 6 6 4 6 20 times morning, 20 times evening for next 1 month. Is it understand? Clear? So second 2 months is over. After third month starting, you are breathing in 6 seconds, holding the breath 6 seconds, breathing out 6 seconds. Aro. Continue ಮಾಡಿ for about 3 months. So you already spent 5 months per cup. So 5 months only your response or resource of the body you are increasing. One of the best resource of the body is oxygen. Settle ಆಗಿ ನಾವು ಯೋಗ ಟರ್ಮ್ ಹೇಳಿದ್ರೆ ಪ್ರಾಣ. Gross form of prana is oxygen. Oxygen increases, lung volume increases. Lung volume increases, your body's response to fight coping up will increase more. ನಾರ್ಮಲ್ ಆಗಿ ಒಂದು 10-20 ಸಾವಿರ ಬ್ಯಾಕ್ಟೀರಿಯಾ ಇದ್ದರೆ ನಿಮ್ಮ ಬಾಡಿ ರೆಸ್ಪಾಂಡ್ ಮಾಡೋಕ್ಕೆ ಆಗುತ್ತೆ ಅಂತ ಅಂದ್ಬಿಟ್ರೆ, ಈಗ ಉಸಿರಾಟದ ಕೆಪಾಸಿಟಿ ಜಾಸ್ತಿ ಆದರೆ 50,000 ಬ್ಯಾಕ್ಟೀರಿಯಾ ತೊಗೊಂಡು ನಿಮ್ಗೆ ಏನಾಗಲ್ಲ. ಅಂದರೆ ಗ್ರೂಪಲ್ಲಿ ಯಾರಾದರೂ ಅಪರ್ ರೆಸ್ಪಿರೇಟರಿ ಇನ್ಫೆಕ್ಷನ್ ಇದ್ದರೆ, ಯಾರು ಸ್ಟ್ರೆಸ್ ಜಾಸ್ತಿ ಇರೋರಿಗೆ ಅಫೆಕ್ಟ್ ಆಗ್ಬೋದು, ಬಟ್ ನಿಮಗೆ ಯೂಶಲಿ ಅಫೆಕ್ಟ್ ಆಗಲ್ಲ. ಯು ನಾಟ್ your body's immunity will increase. You will be able to do this. You will experience one relaxation technique with the background music. Ready? ಏನಾದ್ರು ಕ್ವಶನ್ಸ್ ಇದ್ರೆ ಕೇಳಿ. ಯೂಶಲಿ ಯಾವ ಡಿಸೀಸ್ ಇದ್ರು ಲಂಗ್ ವಾಲ್ಯೂಮ್ ಇದ್ರು ಫಸ್ಟ್. ನಾನು ಬೇಸಿಕ್ ಆಗಿ ಹೇಳ್ಕೊಡ್ತೀನಿ ಯೂಶಲಿ. ಇನ್ನೊಂದು ಸಟಲ್ ಕಾನ್ಸೆಪ್ಟ್, 5 elements are there in this body. ಅಗ್ನಿ, ವಾಯು, ಆಕಾಶ, ಪೃಥ್ವಿ, ಜಲ. ಸೊ ಅಗ್ನಿ ರಿಪ್ರೆಸೆಂಟ್ಸ್ ಪೇನ್, ಸ್ಟ್ರೆಸ್. ಸಟಲ್ ಸೂಕ್ಷ್ಮ ಆಗಿರೋದು ಇದು. ಸಟಲ್ ಗ್ರಾಸ್ ಅಂದರೆ ಈ ತಂಪಲ್ಲಿ ತುಂಬ ಜಾಸ್ತಿ ರಿಸೆಪ್ಟರ್ಸ್ ಬಾಡಿಲಿ, ಬ್ರೈನಲ್ಲಿ. ನಾವು ಮೋಟಾರ್ ಹೋಮೋಕ್ಯುಲಸ್ ಅಂತ ಹೇಳ್ತೀವಿ, ತುಂಬ ಜಾಸ್ತಿ ರಿಸೆಪ್ಟರ್ ಇರೋದು ಇಲ್ಲಿ. ಸೊ ನಾವು ಜಾಸ್ತಿ ಯೂಸ್ ಥಮ್ಸ್ ಯೂಸ್ ಮಾಡ್ತೀವಿ, ಬೇರೆ ಮಂತ್ರಗಳು ಯೂಸ್ ಮಾಡ್ತೀವಿ. Time, any particular time, stomach should be empty, maybe 20 minutes to 30 minutes stomach, and that should not be there. 20 to 30 minutes before, that's 20 to 30 minutes after doing this technique, not have any food. It is not regular. ನೆಕ್ಸ್ಟ್ ಏನು ಮಾಡ್ತಿದ್ರೆ ಎಲ್ಲ ನಿಮ್ಮ ನೋಟ್ಬುಕ್ ಪೆನ್ ಪೆನ್ಸಿಲ್ ಎಲ್ಲ ಸೈಡಲ್ಲಿ ಇಟ್ಬಿಟ್ಟು ನಾವು ಮಾತಾಡೋದು ಕಡಿಮೆ ಮಾಡಿ ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್ ಮಾಡ್ತಾನೆ. ಯು ವಾಂಟ್ ಟು ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್ ಹೊರಗಡೆ ನಾಲೆಜ್ ಕಡಿಮೆ ಮಾಡೋಕ್ಕೆ ಅಲ್ಲಿ ಯೂಸ್ ಲಿಟಲ್ ಮ್ಯೂಸಿಕ್. ಈ ಮ್ಯೂಸಿಕ್ ಹೆಂಗಿದೆ ಅಂದರೆ ಅವಾಗಲೇ ಡಾಕ್ಟರ್ ಹೇಳ್ತಾರೆ ಅಲ್ಫಾ ಬೀಟಾ ಡೆಲ್ಟಾ 4 ಥರ ಬ್ರೈನ್ ವೇವ್ಸ್ ಬರುತ್ತೆ. ಈ ಪರ್ಟಿಕ್ಯುಲರ್ ಮ್ಯೂಸಿಕ್ ವೆರಿ ಫ್ಯೂ ಪೀಪಲ್ ಐ ಕ್ಯಾನ್ ಆನ್ಸರ್ not all, not total. Only counting A's, only counting B's. So it's a moderate anxiety, moderate. I not use this word, but it's moderately stressing. Like more stress. So this is also very easy. There are 4 answers. First two answers I give 0 marks. Last two 1 mark. Anything more than 3 in each is wrong. Unit is perfectly alright. See, what open now extra time spend how much time we have to spend 1 to 1. So I can find out now 1 minute is fine. Somebody is not fine. Somebody is little moderately anxious. Usually bias you can have a bias. So that's why it is arranged in such a way that even though bias is happening, you can calculate. It can be moderate or somebody can severe, but it might be moderate, no problem. When you want to have a clinical assistant, you can find out it. One problem is it's in English. If it is in a local language, it will be much more easy. That will work out. Plan too much of logical analysis will bias. Perfect. Since you will, but you are not interested. In the the more ಮಾಡ್ತಿರಲ್ಲ ಸ್ವಲ್ಪ ಇದೆ ಸ್ವಲ್ಪ ಆತಂಕ ಸ್ವಲ್ಪ ತುಂಬ ಜಾಸ್ತಿ ಇದೆ ಮ್ಯಾನೇಜ್ ಮಾಡೋಷ್ಟು ಮ್ಯಾನೇಜ್ ಸ್ಟ್ರೆಸ್ ಮ್ಯಾನೇಜ್ ಸ್ಟ್ರೆಸ್ ಏನೋ ಟೆಕ್ನಿಕ್ ಮಾಡ್ತೀರಾ ಆಲ್ ಲುಕ್ ಲಿಟಲ್ ಡಲ್ ಟೆಕ್ನಿಕ್ same technique 4-4-4 breathing start ಮಾಡಿ ಮಾತ್ರ ಏನಕ್ಕೆ ಯೂಸ್ ಮಾಡ್ತಿದ್ರೆ I want to dissociate your mind from the back to somewhere else ತುಂಬಾ ಲಾಜಿಕಲ್ ಅನಾಲಿಸಿಸ್ ಮಾಡ್ತಾ I want to use this but ಮೇರೆದಂತ ಮುದ್ರ usually corresponds it looks like S shape so your spine is also S shape so they say that by using this kind of mudra your pain intensity will reduce keep it like this stretch little more stretching like this will make you hold the mudra. After you hold mudra for about 5 minutes, you start feeling the pain. And you are focusing on that area will be more. That pain pathway, then the pain will move to the information. It will make you forget back. Back muscles will be relaxed. In that, and everybody will say. Anytime you can. Say in work stress, you cannot say that only morning time. The other time, 20 to 30 minutes, stomach should be empty. So better than now. Stretch like this and keep it either on the thighs or on the table or fingers. Early morning, evening, late evening is better. ಯಾರಿಗೆ ತುಂಬಾ ಆತಂಕ ಇದ್ರೆ ನಾನು I can change some of class like this. We'll do one more. let our emotions out, we cry or we shout. I use sound. Your body is like a temple, or you call church, or you call masjid, or whatever. The body is that, and in the sanctum, garbhagudi, sanctum sanctuary is your heart, and your voice is bell. I use your voice to create a resonance. This resonance in the body will make your body vibrate in a certain frequency. That frequency is going to bring you relaxation. So what do you expect is interlock your thumb. Again, interlock your thumb. Keep it on the chest. Not down. Yes. So logically speaking, it looks like an eagle. Folded thumb looks like a beak of an eagle. This looks like a wings of an eagle. And say you close your hands like this. Anytime when you, it is a subtle energy concept. Whenever you feel fear, your hand goes like this. That's ಭಯ ಆಗಬೇಕಾದ್ರೆ ಕೈಯಲ್ಲಿ ಇರುವಂಥ electromagnetic energy, it wants to soothe the heart area. Seat of emotions ಅಂದ್ರೆ heart, seat of intelligence ಅಂದ್ರೆ head. So I'm clubbing both science and spirituality. Seat of intelligence is your head. Seat of emotions is your heart. Whenever you feel any fear or anxiety, your hand goes to the heart. Heart will see now. So your hand, subtle energy. If you are too much tired, you do like this. You are doing something which is happening in one direction, but you do in opposite direction. Muscles are working too much strain here, so you do opposite work action to that. ಅದೇ ಥರ ಕಾನ್ಫಿಡೆನ್ಸ್ ಬಿಲ್ಡ್ ಮಾಡೋಕ್ಕೆ, ಭಯ ಕಡಿಮೆ ಮಾಡೋಕ್ಕೆ, ಸೆಲ್ಫ್ ಕಾನ್ಫಿಡೆನ್ಸ್ ಜಾಸ್ತಿ ಮಾಡೋಕ್ಕೆ, ನಿಮ್ಮ ಮನಸ್ಸಿನ ಭಾವನೆಗಳನ್ನ ರಿಲೀಸ್ ಮಾಡೋಕ್ಕೆ ಯೂಶಲಿ ಯೂಸ್ ದಿಸ್ ಟೆಕ್ನಿಕ್. ಹೋಲ್ಡಿಂಗ್ ದಿಸ್ ಟೈಟ್. Again, interlocking the thumb is you are interlocking the fire energy and reducing the intensity of fire. Agni Tattva you are reducing. So it coincides with your yoga philosophy or Ayurveda philosophy. The deep breathing in, breathing out, you can use some resonating sound. Usually I use ooh sound I use. But if some people have a problem with the om or like this, you can use one. Simple. Breathing out, you are going to say 1 or 9 or ooh or om, anything. You say, start with 1. Take a deep breath in. 1. Just focus on your heartbeat. Your heartbeat increases little bit and comes back to normal. Do you feel that? ಉಸಿರಾಟ ಸ್ವಲ್ಪ ಏರುತ್ತೆ ಮತ್ತೆ ಸ್ವಲ್ಪ ಇಳಿಯುತ್ತೆ ಮಾಡಿ. ಉಸಿರು ಬಿಡ್ಬೇಕಾದ್ರೆ ಒಂದು ಅಂತ ಶಬ್ದ ಪೂರ್ತಿ ಉಸಿರು ಹೋಗುವವರೆಗೆ ನಾವು ಒಂದು ಅಂತ 2 more times take a deep breath. 1. Phonation is all same. It is just some resonance is happening. Amen. Amen. Take a deep breath. Anything and everything you want to use, I can convert it into relaxation. So it's an example. Take deep breath one more time. Taking word published, Christianity first. So second, Amin, Islam, this is Amin. Take a deep breath in. It's funny, but ultimately we are getting a relaxation response. Your heart rate is going down. The breathing is comfortable and you feel relaxed. That's my main purpose. You can use anything. Om you can use 2 times. Take a deep breath in. Ultimately, scientifically, you are going to release this hand very slowly. Do you feel little heat between your hands? So that is the proof that you are going to increase the body's prana shakti or subtle energy by using some of the mudras. So idea in this particular last one what you have done is, the resonance will bring you relaxation. This is the hypothesis. And body now the shabda or the body vibrate relaxation is good. You can use anything. I can use my own name. Like this, it is all left to you. These are two techniques. YouTube will get the body. Questions is okay. Exercise silly questions is okay. How the questions is okay. New questions are just better again answers. How we train ourselves. ಏನಂದ್ರೆ ನಾವು ಪ್ರತಿಕ್ರಿಯೆ ಜಾಸ್ತಿ ಫಾಸ್ಟ್ ಮಾಡ್ತೇವೆ. ರೆಸ್ಪಾನ್ಸ್ ಬರೋಷ್ಟಿಗೆ ನಾವು ಪ್ರತಿಕ್ರಿಯೆ ಮಾಡ್ತೇವೆ. ಮಲ್ಟಿಟಾಸ್ಕಿಂಗ್. ನೀವು 2-3 ಕೆಲಸ ಒಟ್ಟಿಗೆ ಮಾಡೋದಂದ್ರೆ ಸ್ಟ್ರೆಸ್ ಲೆವೆಲ್ ಜಾಸ್ತಿ ಆಗುತ್ತೆ. ಯೋಚನೆಗಳು ಜಾಸ್ತಿ ಆಗುತ್ತೆ. ಈಗ ನಾವು ಒಂದೇನು ಹೇಳ್ಬೇಕಂದ್ರೆ ಬ್ರೈನ್ ತುಂಬಾ ಇಂಟೆಲಿಜೆಂಟ್ ಬ್ರೈನ್ weighs only 2% of your body weight. Entire brain weighs 2% of your body weight, but it takes energy 20% of your body. So 2% of 1.5 kg around brain weight. Head weight is kilograms just about. Head weight is usually 4.5 to 5 kg. So 4.5 to 5 kg. So then this why I said how you bend your neck looking at the computer monitor also carries risk. Let's say 75 degree if you are bending, you are going to get neck related issues, headaches, burning sensation of eyes, irritability. If you are bending more, the neck weight usually it will be center of gravity shifts. If your center of gravity shifts, your weight on the neck will be more. Maybe 27 kg to 60 kg depending on how long you sit. So more. So lifestyle related diseases are totally different. It will not come under disease proper. Otherwise those spondylosis are there and they are especially you are using mobile and this itself which can cause neck stiffness, back stiffness, burning sensation of eyes, red eyes, burning eyes and fast irritability. And internet ಅಲ್ಲಿ check ಮಾಡಿದ್ರೆ mobile web clicking waiting time is 3 seconds. Once you click the website, if it will not come in 3 seconds, you feel like closing it. So that is our patience level ಅಷ್ಟು ಕಡಿಮೆ ಆಗಿದೆ. So website designing will not there. If your website is taking too much time to come download or to open, it will not be usually taken. So let's say 3 seconds. If you click, it should come 3 seconds. Within 3 seconds, it has to open. So what I mean is your sensitivity level is high and your patience. That's the answer. Again, ಪೇಷಂಟ್ಸ್ ಪ್ರತಿಕ್ರಿಯೆ ಜಾಸ್ತಿ ಫಾಸ್ಟ್ ಮಾಡ್ತದೆ. ಪ್ರತಿಕ್ರಿಯೆ ಜಾಸ್ತಿ ಫಾಸ್ಟ್ ಅಂದರೆ ಉಸಿರಿನ ಜೊತೆ ಕಂಪೇರ್ ಮಾಡಿದ್ರೆ ಉಸಿರಾಟ ಫಾಸ್ಟ್ ರೆಸ್ಪಾಂಡ್ ಮಾಡ್ತೀವಿ. ಸೊ ಬ್ರೀದಿಂಗ್ ಇನ್ ಬ್ರೆತ್ ಹೋಲ್ಡಿಂಗ್ ಟೈಮ್ ಜಾಸ್ತಿ ಮಾಡಿದ್ರೆ ಅದು ರೆಸ್ಪಾನ್ಸ್ ಕರೆಕ್ಟ್ ಆಗುತ್ತೆ. ಸೊ ಉಸಿರು ಇಟ್ಕೊಳ್ಳೋದು, ಸೊ ದೀರ್ಘ ಶ್ವಾಸ ಬಿಡೋದು ನೀವು ಜಾಸ್ತಿ ಮಾಡಿ. ಇಂಡೈರೆಕ್ಟಾಗಿ ವರ್ಕ್ ಆಗುತ್ತೆ. ಸೊ ಡೈರೆಕ್ಟ್ಲಿ ಇಟ್ ನಾಟ್ ವರ್ಕ್ ಆನ್ ದ ಇಮೋಷನ್, ಇಂಡೈರೆಕ್ಟ್ಲಿ ಇಟ್ ವರ್ಕ್. The relation of breathing will reduce stress hormones.
Like you said, one of the most common issues now is like people are more focused on a mobile or something like that, they get playing games. Is there something which has been discussed or researched upon to avoid it or to, you know, sort of, I know it's personal and case to case basis, but is there something common which has been found out? You know,
In terms of psychological issues or in terms of
let's say an addiction to a game.
addiction to a game. See, I'll take it in a medical way. You are looking into the computer or a monitor or a screen which is having flickering light. Flickering light will usually irritate, increases number of thoughts, reduces patience, increases aggression. The game content itself, if it is 18 plus aggression of blood and all those things, aggression level will be much more. If there's one research conducted somewhere in California, I think, young children, where they give one big balloon, which is panda or something, child, male children, less than 6 years of age, they make them play aggressive games for about 3 months. The moment they see this, they start kicking and punching that particular band. Same idea, same workup they have done on group of girls. They're playing game content is more of flowers, more of pets, more of creative work. You're doing something, you're creating, you're not destroying, you're creating something. When the same children are left with this particular band, they start playing with the band, not hitting as such. So in your question, your acuity, near vision is more. Near vision is more, focusing is more. Focusing is more, concentration is hyper concentrated state. So when you're focusing something very much, what will happen? You'll not be able to defocus. So concentration is more, congestion of eyes. Eyes will not have much of watering. Frequent blinking will not be there. Blink rate is around 20 to 18 blinks per minute. When you're doing near vision, blinks will not be much. Blinking will be reduced by the congestion of eyes. This is the most common problem of IT people.
The de-addiction sort of something is possible. It's a strong word, but
De-addiction is possible by more of a defocusing techniques. I'll share something later. How much time we have? As per time we have finished, but how much time we have, I don't know. Maybe separately. Defocusing is your eyes are made to focus on one particular point and stare for a short duration. You can use moon, you can use some dot on the wall. Focus on it for a short time without blinking. So your hearing reflex will happen. Your eyes will have tears. And then close your eyes and do like this for 3 to 4 times. And then again look at the center of that particular spot. First one what we have done is focusing, intense focusing that we are already doing with the mobiles and other things. Then defocus. Look at the center of that particular spot and try to go away from it later. You're looking slowly, you're shifting your awareness to the next, and then shifting your awareness to the entire room where you're sitting in. Each point you're observing. So by that you're defocusing. Accommodation reflex, you're avoiding accommodation. Accommodation is eyes are converging towards one point. So by defocusing, you're avoiding this particular accommodation reflex. So like this, there are many techniques, defocusing techniques we need to do. So like if you're working on a computer, give a break every 1 hour. Take 10 seconds off the monitor, look at a distant place, very far off the place. Then close your eyes for about 10 to 20 seconds. And then open your eyes, or you can use some cotton and keep your eyes open. So like this, there are a few techniques. Last I think I'll teach you one more fast 3 minutes technique. Instant relaxation technique. 3 minutes I can make you relax by using peripheral blood of your hands, pushing it towards the heart and getting a fresh supply of oxygen and glucose rich blood. That is very easy. And it just takes 3 to 4 minutes. I call it as instant relaxation technique. Similar to what you have done. will use strong dramatic voice. Idea is contraction of some group of muscles and holding it in the same contracted state till we come here. ಕಾಲುಗಳನ್ನು ಮಡಚಿ ಅಷ್ಟೇ ಇಟ್ಕೊಂಡು ಕಾಲುಗಳನ್ನು ಮಡಚಿ ಟೈಟನ್ ಇಟ್ಕೊಂಡು ಅಷ್ಟು ಟೈಟ್ ಮಾಡ್ತೀವಿ. ಆಮೇಲೆ ಈ ಕಾಲು ಟೈಟ್ ಮಾಡ್ತೀವಿ, ಇದು ಟೈಟ್ ಮಾಡ್ತೀವಿ, ಇದು ಟೈಟ್ ಮಾಡ್ತೀವಿ, ಕೈ ಟೈಟ್ ಮಾಡ್ತೀವಿ, ಆರ್ಮ್ಸ್ ಟೈಟ್ ಮಾಡ್ತೀವಿ, ಶೋಲ್ಡರ್ಸ್ ಟೈಟ್ ಮಾಡ್ತೀವಿ, ಆಮೇಲೆ ಹೊಟ್ಟೆ ಭಾಗ ಟೈಟ್ ಮಾಡ್ತೀವಿ, ಎದೆ ಭಾಗ ಟೈಟ್ ಮಾಡ್ತೀವಿ, ಕತ್ತು ಭಾಗ ಟೈಟ್ ಮಾಡ್ತೀವಿ, ಮುಖದ ಭಾಗ ಟೈಟ್ ಮಾಡ್ತೀವಿ, ಕಣ್ಣು ಭಾಗ ಟೈಟ್ ಮಾಡ್ತೀವಿ, ಫುಲ್ ಬಾಡಿನ ಟೈಟ್ ಮಾಡ್ತೀವಿ. ಟೈಟ್ ಅಂತೇಳಿ ಒಂದ್ಸಲ ಹೇಳ್ತೀನಿ, ಆಮೇಲೆ ಅದಕ್ಕೆ ಜಾಸ್ತಿ ಟೈಟನ್ ಅಂತ ಹೇಳ್ತೀವಿ. ಟೈಟನ್ ಅಂತೇಳಿ ತಕ್ಷಣ ರಿಲ್ಯಾಕ್ಸ್ ಆಗಿರ್ತೀವಿ. Okay, close your eyes. 3 minutes technique of instant relaxation. Relax. Sitting like this. Coming to the edge of the chair. Here in your workplace also you can do. Let your neck relaxes. You put both hands on the thighs. You are going to tighten your ankles. And you go so fast that you will not be able to know. ಕಾಲುಗಳನ್ನ ಒಂದೊಂದಾಗಿ ಟೈಟ್ ಮಾಡ್ತಾ ಹೋಗುತ್ತೆ. ಒಂದು ಸ್ವಲ್ಪ ಫಾಸ್ಟಾಗಿ ಹೋಗ್ತೀವಿ. ಕಾಲುಗಳನ್ನು ಟೈಟ್ ಮಾಡಬೇಕು, ಈ ಭಾಗ ಅಂಕಲ್ ಭಾಗ ಟೈಟ್ ಮಾಡಬೇಕು, ಇದು ಭಾಗ ಟೈಟ್ ಮಾಡಬೇಕು, ಹೀಗೆ ಒಂದೊಂದು ಮಾಡ್ಬೇಕು. ಅದು ಟೈಟ್ ಮಾಡಿ ಅಷ್ಟೇ ಇಟ್ಕೋಬೇಕು, ಅದು ಬಿಡ್ಬಾರ್ದು, ಲೂಸ್ ಬಿಡ್ಬಾರ್ದು. ಒಂದು ಭಾಗ ಟೈಟ್ ಮಾಡಿದ್ರೆ ನೆಕ್ಸ್ಟ್ ಭಾಗಕ್ಕೆ ಅದು ಟೈಟ್ ಮಾಡಬೇಕು, ಬಟ್ ಕೆಳಗಡೆ ಭಾಗ ಲೂಸ್ ಮಾಡಬಾರ್ದು. ಸ್ಟೆಪ್ ವೈಸ್. ಕ್ಲೋಸ್ ಯುವರ್ ಐಸ್. Tighten your toes, tighten your ankles, tighten your calf muscles, pull up your kneecap, tighten your thigh muscles, squeeze your buttocks, make a fist of your hand, tighten your forearm, tighten your arm, tighten your shoulders, take a deep breath in, exhale completely, tighten your abdomen, tighten your chest muscles, tighten your neck muscles, tighten your facial muscles, tighten your eyeballs, tighten your entire body, tighten, tighten, and